If you've just been told you need to use insulin during your pregnancy, it's totally normal to have a ton of questions. So in this explainer, we're going to walk through the whole process. And I promise, you're going to see it so much simpler and safer than you might be thinking. Let's dive right in. First things first, I really want to start with this crucial message. The entire goal here is the health and safety of both of you. It doesn't matter if it's for gestational, type 1, or type 2 diabetes. Insulin is this amazing, trusted tool to keep your blood sugar right in that tight, healthy range that's just so important during pregnancy. Okay, let's talk about the elephant in the room, right? For so many people, the number one worry is the needle itself. And look, that is completely understandable. So let's just tackle that fear head on by actually looking at the exact tools you'll be using. So what are we working with? Well, it's really just two simple things, an insulin pen and a very, very small needle. The whole setup is designed specifically to be easy, accurate, and most importantly, comfortable. The pen itself is a brilliant little device. Seriously, think of it like a precision instrument. You just turn the dial at the end to click, click, click to the exact number of units your doctor prescribed. No guesswork, just perfect accuracy every single time. And now, the needle. Just take a look at this number on the screen, 4 millimeters. So, what does that actually mean? I mean, that is it. That's the entire length of the needle that goes under your skin. It is incredibly short, and it's short for a very, very good reason. And get this, to put that into perspective, not only is it short, it's also unbelievably thin. We're talking about the width of 2 of your eyelashes side by side. This is absolutely nothing like the intimidating needle you might be picturing from, getting a shot at the doctor's office. So why this tiny 4 millimeter needle? Why is it the standard of care? Well, it's all about the science. Its length is perfectly designed to deliver insulin right into the fatty layer just under the skin, not deep into the muscle. And that's critical, because it means the insulin gets absorbed predictably, and it's designed to minimize any pain. It is, hands down, the safest and best option. Okay, so once you're feeling good about the tools, the single most important habit you can build is something called site rotation. This is the secret to making sure your insulin works perfectly every single time. See, if you inject into the exact same little spot over and over again, that fatty tissue can kind of get hard and lumpy. You might hear the big medical term for it, lipohypertrophy, but all you need to know is that it's completely preventable. And this chart just shows you exactly why we want to prevent it. When you inject into healthy tissue, the insulin gets absorbed consistently, just like it's supposed to. But if you inject into that lumpy tissue, absorption becomes totally unpredictable. It can cause dangerous highs or lows, and you might even need more insulin to get the same job done. So the bottom line is, rotating sites isn't just for comfort, it's for safety. And the good news? You've got plenty of options. The abdomen is often the go-to because absorption is really consistent there. But your thighs, the back of your upper arms, and your buttocks are also great choices. The goal is just to move around within these areas in a sort of pattern. And let's just tackle a huge concern for anyone who's pregnant. It is 100% perfectly safe to inject into your abdomen. Just remember how short that needle is, right? 4 millimeters. It only goes into the very top layer of skin and fat. It is physically impossible for it to get anywhere near your baby. All right, now that we get the what and the why, let's put it all together. Here is your super simple, step-by-step guide for the injection itself. You got this. Okay, first up, prep, wash your hands, wipe the pen. Second, grab a fresh new needle and screw it on. Third, and this one is super important, don't skip it, you're gonna prime the pen. Just dial up 2 units and push the button to get a little drop of insulin out. That clears any air. Fourth, dial up your actual dose. Fifth, go straight in at a 90-degree angle and press the button all the way down. And finally, number 6, keep it right there and just count slowly to 10 in your head before you pull it out. That makes sure you get every last drop. Oh, and here's a little pro tip that makes things even easier. Because that 4 millimeter needle is so short, you usually don't even need to pinch up your skin. You can just go straight in. It just removes a whole step and makes the process feel that much quicker. So you're doing all this, but how do you know it's actually working? Well, the answer is in your numbers. Checking your blood glucose is your feedback loop. It's what confirms that your technique is spot on and you're meeting your goals for a healthy pregnancy. Okay, so these are the numbers we're shooting for, based on the Diabetes Canada guidelines. Now I know they might look a little strict, and well, they are, but there's a really important reason for that. Keeping your levels right here is one of the most powerful things you can do to protect your baby's health and give them the best possible start. I know that was a lot of information, so let's boil it all down to 4 simple, memorable golden rules. Just think of this as your little checklist for every single injection. Number 1, always use a new 4mm needle. Every time. Number 2, always prime the pen with those 2 little units. Number 3, always rotate where you inject. And number 4, always count to 10 before you pull the needle out. You do these 4 things and you are going to be in fantastic shape. And I just want to leave you with this final thought. This whole process, it's not just some medical chore you have to get through. Every single time you follow these steps, you are taking this powerful, active role in creating the healthiest possible environment for your baby to grow. You're not just administering insulin, you are doing something truly amazing.